it nice and level, good, relaxing. I went into dentistry because I was very interested in science as a young man. But looking around at the different jobs or applications for science, I went in with a toothache as a young man. And at that point, the dentist there in my district said, "This is a very good job to be able to help people." Years ago, I felt that smaller rural communities and northern communities were underserviced. So I started way up north in the Northwest Territories. And it really touched me. It consolidated. I had to learn or apply everything that I'd learned and tried to learn. There was no sending anybody anywhere. I had to learn how to do it. But I gained so much more from the way people appreciated and treated me. And that's what I found over these years. In smaller towns, it's very welcoming and embracing.
I've been a patient with Dr. Carrington for just a little bit over a year now. He has solved many of my neck problems and that, and when he started asking me what I did for a living and how things worked and my neck pain, I did not understand what it had to do with my teeth.
One thing I've noticed severely is, or very obviously over the years, is that certain teeth break at certain times with different people, but there's a pattern on where those breakages are. What I noticed was that the muscles and the joints in the face and head and neck were very, very tense. I treat the dentistry, the issues I see now more in a natural way, in realizing that if we can get the jaw and the head and neck to relax, in fact ask about these things, I feel that I'm treating people, not just teeth. I will find people who have basically been giving everything they can to their children, to their work, and neglecting themselves. And so my philosophy is saying, sometimes getting them to realize this, and that for the future they need to take a little bit more care of themselves. And I notice if they do it for their teeth, they'll start to do it for the other aspects of their health, right? And their well-being and emotions.